All right, so now we have Dr. Rashmi in the hot seat tonight, and I'm going to ask her a couple of questions for our audience. So, Dr. Rashmi, first question. As a family medicine physician, what got you interested in coaching and meditation?
Yeah, great question. I've been a family medicine doctor board certified. This is my 21st year of practice. And over those, couple of decades of practicing, I saw a recurrent theme start to happen within my patient population. And I had practiced in low income, high income, affluent, all of those different places. And it was continuing to follow all of the people that I was talking to. And that really, it started to hit me. It's the effects of chronic stress, like chronic daily stress. And, to define stress is the perception of a threat, either physical or emotional, right? And so it's safe to say that every single person has too much stress. And I started to realize that we really, first of all, I didn't really have the tools personally to deal with my own chronic stressors. And I certainly wasn't able to teach anyone else how to deal with some of those chronic stressors. And we know that the impact of that is quite large, right? I mean, we know that we see skyrocketing cases of chronic illnesses, mental health illnesses, and inflammation, inflammatory illnesses, all of that. And we can really sort of trace it back to, we do not understand how to deal with our stress. And so as that came bigger and bigger and bigger for me, my kids were young, I was working a lot, my husband was working a lot. I actually had dabbled in meditation as a college student. And so I decided to kind of jump right back into it. And it really saved my career. It saved my health, I would say, because I was already starting to suffer from some health consequences along the way, and really gave me a really powerful tool that over time, once I became really comfortable with saying I was a meditator, because I'll be honest, I was a closet meditator for many years because, I trained in a very traditional allopathic medical school residency, was in a very traditional allopathic practice. And I think there's a good place for allopathy. There's nothing wrong with our traditional system in the sense of acute illnesses, but we don't really understand how to help people with their whole health, right? Like mind, body, spirit in the context of environment, which is when I really started to expand my learning and dove into things like Yoga Nidra, Ayurveda, which is really the original lifestyle medicine. So really started to understand that our relationships impact our health. Where we live, our environment impacts our health. How much we sleep impacts our health. How much we exercise, what we eat. And it was mind-boggling to me that I had gone through all of my training with none of that available to me. So once I really got into that, I just absolutely fell in love with being able to teach people meditation. So initially, I would literally grab my staff, whoever was available at lunch, and be like, let's meditate. And I started to see these big changes in them. And so what I did then was I actually went back and I actually became a certified meditation teacher. And along the way, I dabbled a little bit in coaching. I took just one coaching course because I had heard it was really an interesting way to help patients. And I fell in love with that as well, and the whole process of coaching. And so I followed through with that. And now I'm a national board certified integrative health and wellness coach, in addition to being a certified meditation teacher. And that's really the story of how I got interested in it and the reason for my passion for both coaching and meditation.
Oh, that's so amazing. Man, I am so happy that you went away with being a closet meditator, because I know that you are helping so many women right now. That is an amazing, amazing story.
Yes. And I still meditate in my closet, but not because I'm afraid.
Okay, good.
There's just a quiet space in there sometimes.
Awesome. All righty. So the next question is, what exactly is coaching and how is it different from being a doctor?
Oh, yeah, that's a great question. So I really didn't know the answer to this because I'd only been a doctor for, whatever, 19 years by the time I started coaching. So, with doctoring, obviously we're diagnosing and we're treating patients. It's incredibly important. I don't want to downplay the importance of being a doctor, obviously. But really what I knew as a physician was just how to get people to sort of a bit of a neutral point. Like I was so thrilled when the chief complaint was just like well visit and they were actually well, which was very rare, by the way, like pretty much
Very rare.
and they weren't really well, right? But you were still like, okay, I think you have no illnesses. And I think that's what well means. And so we know now that obviously, wellness is not just the absence of disease, it's a whole host of other things. And that's really where coaching comes into play. And so with the integrative health coaching that I do, really meditation and mindfulness is at the very core of that. And we begin to look at some of those other things that I mentioned, which is whole health, which is mind, body, spirit in the context of environment. And we take a vision that is meaningful for the person I'm working with, my client, and we figure out why that's important, because sometimes they have a vision that's a conditioned vision, and you don't want that. You really want something that connects to their heart and their soul that's really meaningful for them. And then there's a whole process that's really based in neuroscience. So we break it down and we go through the process. It takes 3 months for my one-on-one. Right now I have a group program going where we really do it together for 8 weeks. And so coaching is different from doctoring in that we really, in coaching, we're really looking at a very forward motion, action-oriented approach to health versus doctoring. We know that we want to get you from illness to some amount of neutrality or wellness. And so there's a whole different approach and a whole completely different psychology to coaching than being a physician. And both are valid, both are fantastic. Right now, most of my efforts are going into coaching because I've seen the impact of that. And I can't let it go. It's just an amazing thing to be able to do.
Yes, I mean, that's how I feel with running. Like, I can't let it go because you realize how impactful it is. That's amazing. Yes. I mean, when you feel that tug on your heartstrings, that's, the universe or whatever spiritual, entity you believe in, that's it's telling you something to keep on going. So I love that. Alrighty. So last but not least, how do you teach meditation? And can it be used as medicine, like exercise or food can be used as medicine?
Yeah, and I love talking about that because we talked about how exercise can be used as medicine. We know that food can be used as medicine. Lifestyle certainly can be used as medicine. And so I teach meditation coming from a point of I'm going to meet you wherever you are. And so most of the time I'm in a group. Sometimes I do one-on-ones because there's a mantra-based meditation that I do just one-on-one. And so the first tenet of all of it is non-judgment, like absolute non-judgment. And that's really what mindfulness is, right? Mindfulness is paying attention to the present moment with curiosity and without judgment. It sounds so easy, but it's really hard for us to do because we're basically judging everything all the time.
All the time.
So it takes a lot of practice. It takes a lot of practice to come to that point of non-judgment. It doesn't mean you're not judging, but it's something that you're able to let go of as you go through your thoughts and you go, well, that's silly. That's not even true. There's no evidence, that sort of thing. So the first thing is you just got to meet them where they are and understand that meditation is just a formal way to practice mindfulness. That's really all it is. And I talk a good bit about the known scientific benefits of meditation. And there are over 5,000 or 6,000 really large studies that have been done over the course of just the last 15 years, and they show some pretty enormous benefits as far as being able to turn on the parasympathetic rest and restore response. We're even seeing increased longevity. We're seeing increased levels of things like telomerase, where the telomeres are longer, so there's less apoptosis of cells. Talk about how the prefrontal cortex literally becomes thicker in meditators. We look at some intangibles like you're just less reactive. See, you're just not reactive. You see this? So you must be, that running must be working out for you. So in just that way, right? Like we can really become the sort of vision of ourselves that is in touch with our highest selves, that whatever that feels like, that, it should feel like a grounded grounded, peaceful, purposeful way of being. And so that's how I approach meditation. And normally I start teaching short meditations, and then as people get more comfortable with it, then we can go into a little bit of a longer session. But the how we can use it as medicine is very similar to what I mentioned to you earlier, which is I've had plenty of patients and clients be able to wean off of, my most recent one was able to wean off of Ambien over the course of 5 or 6 months, and that was a really big deal. And that was really because she really dedicated her time to mindfulness and meditation practice. Of course, exercise is important. Of course, diet is important. And so really incorporating mindfulness into one's daily life, we can begin to use it as medicine as well.
Oh my goodness. I love that. I love that. And another reason why I love it is because I feel like sometimes patients feel like almost entrapped by taking these medications. So the fact that they were able to get off this medicine by practicing mindfulness is a huge, huge, huge win for a patient. That's amazing. I love it.
It really was. Yeah, it's amazing.
All right. Well, this was an amazing conversation. Now, Dr. Rashmi, if people want to learn more about you, how can they get in touch with you? And I know you have a coaching program, so you got to mention that as well.
Oh, thank you. Yes. Yeah, I do. I have a coaching program. I do one-on-ones. My website is optimalwellnessmd.org. And I've got, the group program that I mentioned to you. I'm teaching a lot of meditation classes online these days, so they can hop on one of those. I'm on Instagram. I'd love to connect. And yeah, thank you.
What is your Instagram handle? So people can
So it's just Dr. and then there's a period, Rashmi Schramm. So it's just my name.
Okay, awesome. And what about YouTube channel? Where can we find you on YouTube?
I am on YouTube. You will find me on YouTube, but I don't have the custom URL just yet. Although I do have 105 subscribers. So I'm working on that. I'm working on how to get the custom thing going.
Awesome. So what can they just type it? Can they type in Dr. Rashmi to find you?
They sure can. Yeah.
Okay. Awesome. Great. And as for me, I also have a YouTube channel as well. You can find me at MedFitDO. You can find me on Instagram also at MedFitDO.
Amazing. This has been fantastic. Thank you.
Awesome. Hope you guys found this helpful. Bye.